at 11:31. And I want to welcome everybody to this year's first School Health Advisory Council meeting. And we will see if you've had a chance to review the meeting minutes from our April 19th meeting. I need to get a motion to approve. I'll approve. Okay, got it. All right, do we have a second on that? Okay. Alyssa, did you catch? Yeah, I'm not good at names. Okay. All right. So we have our motion and our second. All approved? Say aye. Okay. Any opposed? Okay. We're good to go. All right. So the next thing on our agenda, let's see, is introduction of new members. Do we have anybody new this year that's not been here before? Okay. We've got a lot of new people. Okay, so what I'm going to ask, if you don't mind standing and just introducing yourself, and Alyssa's going to take notes.
Okay, so I actually will everybody stand at once, and we'll start on that side of the room and work across, and like honestly, once you introduce yourself, you can kind of back down.
Okay, we'll start with this first table over here. Awesome. Welcome. Okay, awesome. Marvin, welcome.
Amanda Flores, I'm the Turner's Brigade Academy.
Okay, awesome. Welcome.
I'm Amanda Batman, I'm with Waxahachie ISD SHAC.
Okay.
I'm Sydney Hunt, the Executive Director of Special Services.
Okay, welcome.
I'm Rebecca Edelman, the Director.
Clift, all right, awesome. Go ahead.
I'm Jensen McDonald. I'm the Next Step Community Solutions.
Okay. Anyone else? Okay, well, we want to welcome you to our meeting today. Thank you for being here. Okay, so we're going to kind of change up our schedule just a little bit. So we're going to have a presentation this morning by North Texas Behavioral Health Authority. I'll get it out. Do you want to come up here and do the...
Good morning.
I need to find a seat a little bit. I need to go, you need it.
Yeah.
So sorry, I forget I have to speak into the microphone. I'm Ginger Robinson, Director of Educational Support and Counseling, for anyone that's new that did not know. The reason I have kind of just stepped in right before our presentation is any type of action items that we want to take, present to the board that the SHAC has approved, we will periodically throughout the year have those action items. Today, I have one of those action items on the agenda for at the end. We will ask for approval to enter into an MOU with the next presentation that you're going to hear. So I wanted you to keep that in mind as you're listening to them, to try to see if it's a good fit for Waxahachie ISD and for our students. And if you think so, we're gonna have that as an action item later at the end of the SHAC meeting.
Thank you, Ms. Robinson. Hi, my name is Dr. Alzada Benton. I am the MST program manager. MST stands for Multisystemic Therapy. So what is MST? It is a community-based, family-driven treatment program for youth with antisocial delinquent behavior. The focus is on empowering the parents and the caregivers. Normally when treatment, we're talking about students and youth, the services are usually just for the students. But with MST, it's a little different. We kind of really work with the guardians and the parents in the home and giving them skills and tools. So the MST client is the entire ecology, not just the youth, family, peers, community, and also the school. There's also a component of supervision where it's very highly structured. So I meet with my therapist and my staff at least twice a week, and we go over every case. So it's not like just one therapist making decisions on how to progress families. There's multiple minds involved helping those families. And this also includes an MST expert. So the MST expert is kind of like she's been through as a therapist, a supervisor. Now she is training program managers and supervisors. So she works with us very closely as well. Right now I want to show you guys of a video. I think I'm a very visual person. And so this video is going to kind of really show you how the therapist goes into the home and works with the youth and makes change.
15-year-old Jordan was referred to multi-systemic therapy after he had been arrested for breaking into an empty house with a friend while high on his mother's prescription pain medication. In addition to drug use, he also had a history of fighting, skipping school, and running away from home. Jordan didn't care what he did or where he would end up. When his mom expressed her concern for him, he always stated that he simply just didn't give up. But more than anything, Jordan's mom feared he would end up incarcerated just like his father, who had been locked up since Jordan was 10 years old. Multi-systemic therapy, MST for short, is what saved Jordan from following in his father's footsteps. Here's how. Instead of placing a youth away from home only to release them back into an environment where nothing has changed, MST treats the problem within a youth's natural ecology, their home, school, and community. When a youth starts multi-systemic therapy, a key process they will go through with their family and therapist is a fit assessment. The fit, as it is commonly called, is an MST tool that helps understand problematic behaviors by identifying what is driving them. By following the MST fit assessment process, it makes it easier to prioritize which behaviors and drivers to target first, and then properly develop measurable treatment goals. Jordan's most troubling actions usually happened when he had left home, so his family and therapist decided to target that behavior first. His fit circle for running away from home looked something like this. Jordan and Mom sometimes fight because Mom tells Jordan that she doesn't want him to end up in prison like his dad. Jordan gets upset when his mom says this because he misses his dad and doesn't know how to have a better relationship with his mom. Mom doesn't know where Jordan goes, doesn't know how to find him to get him to come home, lacks skills, and feels hopeless. Mom doesn't know Jordan's peers. Supervision gaps when Mom is at work, so Jordan can run away before she gets home. There are no clear expectations, rules, and consequences for Jordan's behaviors. Jordan is not involved in pro-social activities with pro-social peers. After carefully analyzing Jordan's fit circle, the drivers his therapist and the family agreed to prioritize first were: there are no clear expectations, rules, and consequences for Jordan's behaviors. Mom is unsure how to find him and get him to come home, lacks skills, and feels hopeless. Jordan is unsure how to communicate with his mom, so they have conflicts. The goals identified were that 1. Jordan's mother would set clear expectations with matching consequences and rewards. And 2. Jordan would work to communicate with his mother and express his emotions in a healthy way. For Jordan's mom, being the only parent in the house made her feel hopeless. However, the therapist helped her get the confidence she needed to put clear expectations and consequences in place. The first was that Jordan would be allowed to go out with friends, only if he was home on time and shared his location with her on his phone. If he complied, he would get extra time to spend with friends over the weekend. But if not, his phone service would be turned off. Jordan did not like the sound of this at first, getting defensive and verbally aggressive about having his things taken away. The MST therapist, who was on call at 10 p.m. when the conflict occurred, understood Jordan's frustration because he was not used to having consequences. Together, the therapist and Jordan's mother explained how we all have consequences for our actions. even adults, and the importance of being held accountable. After an empathetic conversation, Jordan calmed down and realized he needed his phone service on in order to personally call his dad and stay in touch with his friends. So he soon adhered to this. After learning more about Jordan, his therapist noticed his deep love for basketball. She asked why he didn't play on his school's team. And he admitted that he and his dad used to play and talk about it nonstop. But after his dad's arrest, he gave it up. It wasn't easy, but through persistent motivation, Jordan's mother and therapist empowered him to try out for the basketball team, which he ended up making. They then worked with the corrections facility where Jordan's dad was located to get the two of them to start visiting with one another again. First it was over the phone, then face to face. Because they both shared a love for sports, Jordan began to update his dad after each game, which helped them rebuild a relationship that once seemed impossible to repair. By understanding and treating Jordan's interconnected actions, his behaviors began to improve in all areas. Jordan was not inclined to skip school, now that he had to attend to stay on the basketball team. In addition, he also formed pro-social relationships with his coaches and teammates, who motivated him to try out for football in the fall. Having his phone location always shared with his mom and having regular sports practices after school gave mom peace of mind and more confidence to create other expectations with rewards and consequences down the line. MST works because it considers unique behaviors and the systemic context in which they occur, and it empowers the family and surrounding systems to be agents of change. It is through this empowerment that caregivers learn it is possible to manage their own youth's behaviors and create long-lasting positive transformations. MST, proven results for families and communities.
So as you can see, the therapists, they're inside the home, they're in the schools, they're in the community, even jail, to make contact with father. So we try to connect the whole ecology to eliminate that youth's behaviors. Who's appropriate for MST? Any youth involved in juvenile justice, mental health, child welfare systems, youth that are identified in the school systems, youth that are at risk for being placed outside the homes, youth that are involved in the court system, youth returning from placements such as psychiatry visits, returning back home from foster care back into their home. Currently, foster care, they have a plan for permanency. We also work with those youth as well. All we ask is that youth to be between the ages of 12 to 17 years of age. These are the youth that are at risk for, severe consequences. And these are the families that you think of when parents like, I want this kid out of my home. I want them in boot camp. I can't deal with it because they're, have all these antisocial and delinquent behaviors that they can't handle or deal with. Some of the criteria for the program, we're looking at things like theft, aggression, assaulting, fighting, substance abuse, selling substances, chronic absences from school, truancy, and they can have some sexual offenses if they're in conjunction with any other antisocial behaviors. And so some of the programs that we try to avoid with our program is any additional arrest, being expelled from school, being placed in child welfare, and also being arrested again. So some examples of what is not appropriate for MST, youth living independently. We ask that the youth live inside the home because we need the system of the family or a guardian to create a bond with that youth. If the sex offending is absent of any antisocial behaviors, we can't accept those youth. And youth with moderate to severe autism, we will take youth with highly functioning autism. Also, if the youth also have any intellectual developments, we also can't take those youth as well. If they're actively homicidal or suicidal, we ask that the suicidal threats be absent at least 30 days before accepting to our program. And then any youth, if the mental health is the leading cause for the referral. The referral, we only focus on behaviors with youth. We believe that families are the solution, is why we ask that the families be at home and be involved. One of the questions that I ask is that, when I speak to a parent, are you willing to participate and be involved as well? They have to be involved in the long-term planning process, because when MST leaves, we want the parents to be able to function as if MST was in the home still. And so MST is a evidence-based program, and so we do have a strong track record of good client engagement and satisfaction and retention as well. So here's an example of the whole social ecology that we work with. Yeah, we get a referral for the youth that's in the middle, but we also work with the siblings. We work with the family members, including aunts, grandma, whoever's involved. We also work with peers, the neighborhood. We also look at the neighborhood to see what external factors are affecting that youth. We like to work closely with schools, because a lot of times we find that families have a difficult time communicating, their needs with the school, and vice versa. The schools may have needs that they want to work with that family or youth with, and so the therapist is kind of like a mediator to help that family. And we also work with other agencies, as I talked about before, mental health agencies, CPS, and also probation. Change happens when we work with the family on improving how they function, how they put in rules, and we also connect with the peers, the school, and the community to decrease, the antisocial behaviors overall. A single therapist has a caseload of 4 to 6 families, so they have a very small caseload because it's very intense. There is a team of 4 therapists to a supervisor. The therapists are on call 24/7. 24/7, they're on call. The families may have tried an intervention, it doesn't work, they can contact that therapist to get more guidance. They hold the cases 3 to 5 months. On 4 months average, we kind of look and see at the case and kind of see how the behaviors are going. And so we have like 5 weeks where there's no behaviors. We start working on the next behavior, and they start looking at discharge and how to sustain the family. But the work is done in the community, at home, in the school, and in the neighborhood. NIPA was one of the 7 programs that was chosen here in the state. This program is funded from the state after the aftermath with Uvalde. Looking at Uvalde, they looked at that youth had a lot of antisocial behaviors and disconnections from their family. And so MST, with the evidence-based program, been around 20 years working with this type of youth, they thought to put this program here in Texas. And so we're lucky that we're one of the first sites. We accept referrals for the program. There is no cost to the families. It is grant funded through the state. And we also have bilingual therapists on staff. So to make a referral, you can fill out a referral form. Ms. Robinson has that referral form, but just email it to mst@nipa.org. And if you have any questions, you can contact myself as well at aben@nipa.org. Or Janet Buchanan, she's right here behind me. This is the program director. Her email address is there as well. Thank you.
Do you want to take questions now, or do you want to wait until the end? What's your preference?
I can take questions now.
What do you want to do? Let's do, so we're doing a couple of different presentations. If you have any questions about the multi-systemic, I'm not going to say it right. Multi-systemic therapy. Yes. Anybody have any questions that you would like to ask?
Who makes the referrals? Can a parent make it for their own child?
Yes, a parent, anybody in the community, any agencies can make a referral.
We have, they met with our school counselors last week. We met with our DAP director and counselor as well. So we're kind of hoping that we can kind of streamline that and make some referrals within the schools.
What if the kiddo is already in foster care, and we addressed that, if they're already in foster care, can they still get?
Yes, they can still get services. If there's a plan for permanency, where they feel like that youth is not gonna be going back to their family, we can work with you.
Any other questions?
Well, hi, I'm Jana Buchanan. I am also with NIPA, and I am the director for OSAR as well as MST. And OSAR stands for Outreach, Screening, Assessment, and Referral. And basically what we do is we have LCDCs or OSAR counselors that meet with individuals that they maybe don't know how to start getting treatment for substance use. or maybe they don't have insurance, or if they have insurance, they don't know how to, what services they need. So they meet with us, we do a screening, our screening is free, we don't charge anything for that. We help link them up with a provider for whatever type of services from the screening determines they might need, whether it's detox, peer support, residential, or outpatient. And so if they're not insured, we help get them state funding. So we apply for that and get that to cover their treatment costs. OSARs are all over the state of Texas. Our OSAR team, we cover Dallas, Ellis, Hunt, Navarro, Rockwall, and Kaufman counties. We're in Region 3, and LifePath and MHMR Tarrant County cover the other counties, like Collin County and Denton. So we accept referrals from everyone, self-referred, CPS, schools, law enforcement, criminal justice, social service agencies, hospitals, family members, just about anybody. We serve ages 13 and up. So part of our service array that we do is not only just the screening, but we help, like I was saying earlier, link them up for funding or link them up with a provider in their network. If they have insurance, we do community referrals as well. If they need help with transportation getting to residential, we help pay for or get transportation to get them there and then back home after they're discharged from residential. We offer referrals to recovery support services like a peer recovery counselor. We also provide Narcan for free in the community and for those that may need it, families. We also do education on that as well. We do outreach community events in the community, and we also coordinate with care coordination. Sometimes if somebody has trouble with transportation, then they need to be seen with one appointment to get everything. They'll meet with care coordination and an OSAR counselor at the same time, so when they leave, not only are they getting their mental health or community referrals, they're also getting their substance use treatment scheduled and referred. And we offer our services in person through telehealth or phone screens. So under the umbrella, NIPA, we have, like I was saying, these are the areas. We have providers in our network for those that are indigent that provides recovery support, outpatient, residential services, detox, or opioid substitution therapy, which is MAT services. So we just determine what they need and get them referred to the appropriate agency. And we have several agencies that are contracted with NIPA for that, like Child and Family Guidance for mental health. We have Homeward Bound, Synacor, there's a long list of them that we choose from. So if there was a need for a referral, people can self-refer as well. They can either call us at 844-275-0600, or they can email us a referral form, which is at osar@nipa.org. And also, it wasn't in there, but we also do free presentations in the community on any substance-related topics. So an agency or group would need a presenter, we do that for free. And we do fentanyl awareness, Narcan presentations, marijuana awareness, alcohol, you name it. You let us know what topic is needed, and we can send our presenter out to present. All right, I'll turn it over to.
Okay, my name's Serena Bailey. I am the care coordinator for Ellis County. So what is care coordination? Care coordination consists of linking individuals to resources within the community who have mental health needs or substance use disorder. Care coordination can be found in Ellis, Hunt, Kaufman, Navarro, and Rockwall counties. Care coordination also offers support with housing, utilities, food, medical, dental, transportation, employment services, parent education, and other supports within the community. So the role of the care coordinator, we receive referrals, complete preliminary reports, schedule and complete a needs coordination screening with each individual. And then after the screening is done, we make referrals to resources within the community to assist the individual with whatever they're needing help with. And like Janet said, we do combo appointments with OSAR. And she explained it, if they only have a certain amount of time, we can tag team together and get everything done in one meeting. Care coordinators follow and track referrals for 30 days. We follow up 7 days after we have the coordination screening, then 14 days, and then at 30 days. And then if they require any additional support, we keep the referral open longer to assist them with that. But if not, then we close it out after 30 days. And so we receive referrals from jails, judges, probation officers, hospitals, the community, and school districts. So the community would include like family. I think I've even had like people call in as a self-referral. So, and then we get referrals. So any of those organizations, they can identify someone that needs help within the community, and then they refer to the care coordinator by filling out a referral form and emailing it to South and East Care Coordinators at NIPA.org.
I'm Crystal Keene. I am the case manager for a few of our housing grants. But you could hear me, so that's good. Our housing grants, for Ellis County, that's primarily going to be COVID-19 grant funding. So, if anybody has individuals that have gotten a little behind on rent, or are needing assistance with initially getting into a place, as long as they have substance use disorder or mental health diagnosis, we can typically do some temporary short-term housing assistance and funding.
Janet, I actually have a question for you. I know that you said that y'all also do the Narcan training. If somebody is needing to have Narcan in their home, do y'all make that available?
Yes, if they contact us at the OSAR, we'll arrange to meet them, or they can meet us at probation where we're at currently and pick up a Narcan for free, or I've even gone out in the community to give them the Narcan.
Okay. All right,
We
good
do
deal.
provide that for free to agencies as well as individuals or family members.
That's good to know.
I did forget one thing.
Mhm.
Housing, it also can assist with utilities. So if individuals are behind on utilities, we can assist with that.
Okay, awesome. All right, any questions? Thank you, ladies. We appreciate it. Is there one back there? Oh, Reverend Baker.
Yes, I have a question on the housing. Is there a number to contact?
If you just contact, you can send to that same South and East coordination email, and it'll get to the right person.
Okay. There you go, Reverend Baker.
Thank you.
So currently, is the whole Nortex Federal Health Authority located in one place? Like, where are y'all currently located?
Our main office is out of Dallas, but we have a presence in all the 6 counties that we serve. Currently, we are kind of temporarily housed at the Juvenile Probation Department, but we are looking for a facility to open and house all these teams in one building here in Ellis County soon. And we do have an office in Kaufman as well.
Okay.
Oh, and I'm also at the Child and Family Guidance Center and Adult Probation.
All right. Any other questions? Okay. Thank you so very much. We appreciate it. Okay, we're going to go ahead and move along on the agenda, and we're going to do some of our SHAC updates at this point. And I'm going to ask Tom, do you mind coming and sharing?
All right. Hello, I'm Tom Koch. I'm the Director of School Programs with Reach Council. Just want to let y'all know we've gotten most of the schools' requests for Red Ribbon Week. There's a handful that maybe haven't had a chance yet, so we're getting pretty full. So if your school is interested in doing presentations, activities involved with that, please contact us as soon as possible, because it's pretty full schedule right now. In the past, we've been able to do bracelets. This year, we're not able to. Our distributor fell through at the last second, so we're working on an alternative. We're still trying to figure that out, but hopefully here in the next few days, we'll be sending out some emails through Ginger and through the campuses to let them know what we're able to offer. So we'll try and get those turned around as soon as we can, so we can get those distributed to campuses and students as soon as possible. Kind of in that same vein with presentations and whatnot to do with Red Ribbon Week, or any other time of the school year. We do presentations year-round. We do curriculums year-round. We have the MOUs with Waxahachie ISD to be able to do those. We've been getting a lot of requests from other school districts in reference to things like Tucker's Law, the House Bill, I think 114 with the vaping. So we have different programs that can work with the different schools, depending on what your needs are for addressing those programs, those new laws, and those policies that have been required. So we're happy to help out where we can and provide those services. All our services are free, whether it's presentations, curriculums. Our youth recovery program, again, is another great one, too, for students that need a little more assistance on a more peer one-on-one level. We can work with that as well. Any questions about anything as far as presentations, curriculums, Red Ribbon Week, all that fun stuff? All right, if you do have any questions, I'm happy to talk to you after this, or email me or call me, and we'll get you set up.
Okay, and I've got a couple of things I'll share as well. We've got the prescription drug take-back event that's going to be coming up on October the 28th from 10 to 2. We'll be set up in the Coleman parking lot, so you can share with your friends and family members if they want to clean out their medicine cabinets and safely dispose of their medications. We will be out there with the Waxahachie Police Department doing that event this year. One other thing, I actually had a flyer out there. We are actually working on our RISE Mental Health Conference. It's actually going to be held at the Pathway in Burleson. It's free to the community. We actually have free childcare that's going to be available as well, and CEUs are going to be offered. We've got some really great keynote speakers that are coming in. We're going to do a little kickoff on Friday night. We have a comedian that's coming in, and then Cheyenne Davis will be presenting on Friday night, and then we have a full schedule on Saturday, and Mind Above Matter is actually one of our sponsors. Shout out to Mind Above Matter. They're actually going to be doing some of our breakout sessions for us. We've had a couple of key sponsors that we have. We've got Texas Health, Mind Above Matter, and Discovery Point are just a few of the ones that we've had come out and actually are helping to sponsor the event. So it should be really exciting. You'll actually walk away with some tangible items for your toolkit on this, and the goal is to help you find your strength. And so again, it's free to the community, and again, free childcare. Okay, let's see. The next thing that is on the agenda is Ginger Robinson. You jumped right on me.
I was trying. I just wanted to give an update from last April, just kind of where we're at, just to let you guys know in the counseling department how the SHAC has been very important in some of the decisions that have been made. So I made several handouts. Sorry, I don't typically have that many pieces of paper, but I did just for you, EJ. So the first one that I want to talk about is Mind Above Matter. Sherry mentioned them sponsoring. So you have a flyer. Last year, our SHAC committee approved for us to enter into an MOU with Mind Above Matter. We did start the clinic a week ago. We started at the beginning of the year, but we started taking clients last week. Within our district. We have transportation running from our high schools and our junior highs for our students that need to get to the clinic. And it's successful. So I just kind of wanted you guys to know that our students are being able to receive their therapeutic aftercare after school. They start at 2 o'clock. They go from 2 to 5 or 2 to 7, depending on their programming. But we are able to offer that to our students so they don't have to withdraw from school. That's what we were learning with our students, is when they needed this aftercare treatment, they were withdrawing from school for 4-6 weeks and getting so far behind. We're not having to do that now. Our counselors adjust their schedules so that they can leave school at 2 or 1:45-ish, and then they go over and complete their day at the clinic. And then they have transportation that picks them up after school. So I just wanted you guys to know that it's amazing. As throughout the year, we will be able to report data on that to you all as well. I see Angela looking at me back there. So I know that we'll be able to report data to you guys on numbers that we served and things like that. The other one that came through SHAC as well that we're really proud of is our agreement with Care Solace has also started as of September 1st. Care Solace is a referral program for all of our students, their families, and our staff members as well to find any type of mental health or behavioral health that they may need through this organization. So we have a QR code, we have a website that parents can they can go there themselves. They don't have to go through a school counselor, but it also allows our school counselors to utilize Care Solace to help our families find the needs, find the perfect match for what they need for their behavior or mental health needs. Once we do a referral, we have a dashboard that we can see how they have progressed through their treatment plan, whether they've reached out to the facility, how many sessions they've attended. So it's so super informative to our counselors to see that our students are able to get that help with whatever their mental or behavioral health need is. It's great because it saves time for our counselors, where we would spend hours trying to call, help them find referrals, help families connect with the right type of counselor or what kind of needs. It might not be the right need. We have somebody else that does that for us now. So Care Solace is working with us, and that was approved by the SHAC as well. So I just wanted to give you all those updates. Very excited. That I will tell you, we are very fortunate in Waxahachie that we have such a wraparound services for our students. It's a huge blessing. I keep hearing that it's not like that everywhere, y'all. So I just thought I'd throw that. It's not like that everywhere, y'all. The last thing I just wanted to bring to your attention is September is Suicide Awareness Prevention Month. So we have, throughout the month, we have public service announcements on our ISD sites. We do them at the high school, pushing them into classrooms. So each week we focus on a certain topic to help our students. We've also had presentations at our high school earlier this week for suicide prevention for our 10th graders. Globals is next week. We want to be able to teach our students to be aware of signs, what to do if they have a friend that is in need, or also if they're in need, of how to reach out. So we've been doing those presentations as well. So here's what we cover, our topics that we have been for the last 4 weeks. Next week is week 5. Yeah, I know it's October, but it's okay. Yes. And then finally, next week we will push out onto our campuses this flyer. It actually is laminated and really pretty, but I didn't want to do that. With a QR code. The QR code at the bottom takes them to our counseling website where all of these resources are listed. So if a student, we're going to hang them strategically around the campus, restrooms, cafeteria, things like that. But all they got to do is scan that QR code. It takes them to find out about Care Solace. It takes them to find about Mind Above Matter, Next Step, all of our programs. They can do it with just that one simple QR code. So we'll start hanging those out at the end of our prevention week, or next week, as we hang them around campuses. So that's it.
Tell them what the programs are.
Yes, it does. Yep, each one has a tab on our district counseling webpage that they can, each one of them has a whole description and how to reach out if they need help. And it actually, for Care Solace, they'll take them straight to that website where they can type in their needs and have an assessment done. Any other questions? Okay, thank you.
Okay, next we have Lieutenant Christopher Dickinson that's going to give us our security update.
All right, hello everyone. For the new people, I am Lieutenant Dickinson, Waxahachie Police Department, also Director of Safety and Security here with the ISD. You probably, if you were here last year, you heard us talk a lot about vapes. That was kind of the hot topic every single meeting. We implemented some things towards the end of last year. This thing feels like it's right in your face, doesn't it? So we got the vape detectors in all the schools now that are in the bathrooms that alert in the fluctuation of air. You know, they're pretty neat. So we have that in place. And then, of course, you may have heard of a new law that now requires stricter punishment if caught with a vape. It's mandatory DAP kind of thing. And we pushed out a lot of information about the dangers of them and don't bring them to school. And I am happy to report, as of a month into the school year, our vape confiscation is extremely low. So what we have done seems to have worked. I'm not going to call it a success a month in. We haven't ran parking lots yet, so it may just be that it's being left outside. But we'll discover that here in the next few weeks probably. I don't want to give the exact date in case anybody's watching. But the vape thing seems to took a turn for the good. So I'm happy to report that. Other than that, really, I would say in that same breath, the illegal drugs in general have kind of slowed up. I'm going to knock on some wood here in a minute. But that's great, and I hope it continues throughout the year. That's all I got.
Chris, how were parents notified? I mean, I don't know if everybody's aware of the new policy or new law that went into effect. Does the school district notify?
Progressively so.
Progressively, okay, that way they're not.
Progressively so. So all parents, also our fine arts programs, our coaches, none of these programs want to lose players. None of these programs want to lose participants. Our ag folks, you name it. You got an animal and you have a project. You've invested $1,500, $2,000 in this project. You're vaping within school grounds at school function, 10 days, whatever DAP, you can't do that activity. It doesn't matter if the fair is the next day, you're done and you've lost your investment. It's a big deal and a big deterrent. It's a positive peer pressure to avoid the use. So as Lieutenant Dickinson, Officer Nolan here will say, we're not seeing it at school near as much as we have in years past. We'll continue to be vigilant and look. We really don't want to lose kids, and the programs needed to the directors and the coaches. So they've stressed that the participants don't do this.
Yeah, and that was pushed out on every platform we could possibly push that out. I'd be hard pressed to find somebody that doesn't know the penalties on that at this point. Off I go.
Thank you, sir. Okay, next we've got the WISD Health Update by Melissa Bousquet.
Hello, I'm Melissa Bousquet. I am the Director of Health and Wellness for the newbies in the room. It's so great to have you guys, and we appreciate everything you do, especially for volunteering your time to be here. I'm going to start with drug testing today, just to kind of go along with what Chris was talking about. Our random drug testing program is a completely different program than what he was talking about. He was talking about a program, he was talking about discipline for drug use in the schools. Our random drug testing program is different than that. The purpose of it is more to give people, as you know, if you've been around for a while, give kiddos a reason to say no, and to maybe give them that incentive they need just to abstain from all that kind of stuff, because they have a team or a band or a group of kids that depend on them to be available and able to participate in that activity. So I said all that to say we had kind of a first over the summer this year. We had a couple of students that had a second positive at the end of last year. I think I shared with y'all. And the second positive brings on a much steeper exclusionary time from the activity. So you go from 10 days for the first offense or first positive to 90 days for the second. So that carried through the summer. It's carrying through the beginning of the year. Since it was a first time for us, there's some things we're learning from that we need to tweak a little bit. And for all the counselors in the room, if y'all see anything that you need to bring to my attention, something that we need to fix, please let me know. But it's been interesting to kind of see how all that's played out. And it is a much steeper exclusionary period. So, but again, that's not a disciplinary policy, doesn't go on their record, there's no Challenge Academy time or anything like that, so it's completely different. We're about to get started with drug testing again this year. Our district is growing, and the numbers of kiddos in the pool, in the drug testing pool, is also growing. So anyway, we're getting ready to get started, and all that is going just fine. As far as COVID goes, first couple of weeks of school, we had a couple hundred cases of COVID. We are down to just probably less than 5 right now. So I think initially we got back together, we shared some germs, some of us got sick, and we're done. So hopefully we'll be good to the next time we are out of school for a while, which will be Thanksgiving, and we may start it all again. Who knows? But fortunately, people are not getting as sick. We have, as a district, decided to remove the mandatory 5-day absence if you test positive if you're a student. We are just following our normal illness policy guidelines for COVID as we would any other illness. So we're trying to kind of normalize that and, just make it less complicated, basically. All right? So the last thing I'm going to put on my wellness hat now. This is the year for our triannual wellness policy audit. Am I saying it right, Cam?
Just a review.
It's a review. Okay, it's not actually an audit. So as a result of that, we need a committee that will look at that. So I'll be leaving a sign-up sheet here. Is there anything you want to share about that, Cam?
It's just gives an opportunity to update any policies on student health, student nutrition. When we put it in place, 3 years have passed, so we find probably some weak points we need to strengthen, maybe some we're too strict on. So we just need to get those updated and have everyone kind of take a look at it and help us out.
So we would really appreciate some volunteers to be on that committee. You'll have the opportunity to sign up for it here when we're finished. And there'll also be another sign-up sheet, but I won't tell you about that till we have our next presentation, all right? Okay, any questions for me? No, Sandy's not here, no. All right, thank you, ma'am.
Okay, since Sandy is not here to do the WISD Community Involvement Update, we're going to move on to our next presentation. And let's see, this presentation is the school-based health clinics with Rebecca Edelman. Are you going to come sit here? Or do you?
Okay, so I'm Rebecca Edelman. I'm at Clift Elementary. I'm the nurse over there. And I'm going to be talking about school-based health centers that are pretty popular around our state, and just a little bit about them and maybe something that we can look at as a district as well. So we're just going to go over what it is, specialties, the benefits of them, and then districts that have them. So a school-based health center is a facility managed and run by a school district. Sometimes they do it independently. Other times they do it in conjunction with a partner, like a hospital setting, like Baylor, for example, or a health department, things like that. And they give all sorts of health needs to children. It's not just like you think owies and boo-boos and colds and stuff. It can be mental health, it can be dental, things like that. So the purpose is to focus on underserved populations. They're usually a convenient location on a school district somewhere on campus, so that kids feel comfortable. We emphasize prevention, trying to see kids before problems arise that keep them out of school. It decreases absences because we're able to manage their chronic diseases, helps build relationships with the students and their families. We can refer to community providers when they need it, if we need additional help that we can't give them at the clinic. Obviously, we're culturally sensitive, as some cultures treat diseases different ways. It reduces the health barriers that some of our families have with getting into clinics, and promotes healthy development. So these are some of the things that you can offer at the clinic. You can do vaccines, well child exams, you can do sports physicals, education, mental health, dental screenings, and like disease management like asthma. One of the first centers that opened was actually in our area in Dallas in the 70s. It's grown to be in 48 different states. There's over 2,000 of them, and there's currently around 90 of them in the state of Texas. This is a little hard to read, but it's kind of just going over what we can offer the kids when they come. So it reduces costs for parents when they don't have to take their children to urgent care or emergency care. It allows the parents to stay at work. Some of the clinics allow the children to go from like middle school or high school by themselves to the clinic, and then we teleconference the parents into the meeting, and so therefore they wouldn't have to leave their work. They could just take a break at work and still be in the meeting.
reach populations that are less likely to receive care, helps the kids stay in school, just different things to help them stay in school as much as possible. Some of the team members that are on some of these school-based health centers, nurse practitioners, usually physician oversight is like with the hospital or any other partnership they have. Psychologists, nutritionists, dentists can come in and give dental care for kids who don't have coverage, and then many more can be part of that team. 59% of the centers that they surveyed get state government funding to help run the clinics, and then 68% said that they bill the public health insurances when it's available. These are some of the school districts that have a school-based health center available. Some of them, like I said, are right in our area. Some of them are a little further out. They may, their kids may not have access to like a hospital that's nearby, so they run it by themselves. Other ones like Mansfield are partnered, and Fort Worth are partnered with neighboring hospitals. That way they're able to tap into their referral networks. And then I just learned today, Midlothian has a clinic they've been running since 2018 for their employees and their dependents, and they may go further than that in the future. And then those are just my references, and I just think this is great because it can improve attendance rates for our school district, and then just help us keep our kids healthy and engaged.
Couldn't see it on your slide, but does this do vaccines too?
Yes, they would provide vaccines, which is especially helpful in the beginning of the year because a lot of parents are scrambling to try to get their kids in and they can't get in for weeks. So they're usually having to travel to Dallas or Corsicana or some other health department to try to get vaccines when they can't get into their pediatricians.
To give you guys a little bit of context, we've looked and had presentations from a couple of different companies come to SHAC and talk to us about maybe setting up some sort of telemedicine system where kiddos that come into the clinic and they need maybe more help than the campus nurse can give them, can, call into this telemed. This is like a different alternative to that. We have looked into those companies, and there's just some things about it that we're not sure would work always. So this would be a different way to address that. This would be where kids could actually be seen in person by somebody that can help them out and give them whatever it is that they need to feel better so they can get back to class, because that's what it's about. We want to keep kids in school. So I'm going to put a sign-up sheet out. We're going to form a committee to just explore this. This is something we want to look at. There are a couple of options. Like Rebecca said, you can do it in conjunction with a healthcare facility. And of course, we automatically think of Baylor here, but that's something the committee will look at, or the district can run it. So those are two things that the committee needs to look at, and also if this is a route we want to go. So anyway, I will also be putting a sign-up sheet out for that. Any other questions for Rebecca?
Is this something that you're looking to implement this year, or will it be next year?
No, it would not be this year.
Okay. Go ahead.
No, it would be, yeah, it would be its own self. It would be someplace on a campus somewhere that we could set up, or in some district facility. There would be a lot of things to talk about, as you can see. But this is I think it works well for a lot of districts, and it's something the way we're growing, I think we need to look at it.
All right, so I believe that takes care of the items that we have currently. Let's see, so you want to go ahead and do the subcommittee formations, and then we'll do that was all of that? Okay, so you'll just put the papers out here for everybody. Okay, then Ginger, I guess I need to get with you on doing the action items.
So as I told you, we have a lot of resources through Waxahachie ISD that we are able to offer our students. One of the things I would like to add to our list of resources is the North Texas Behavioral Health Authority program that we that presented at the beginning. So what we have had, we've been able to see a sample of an MOU. I have sent that over to Mr. Aubenshine. He has seen it and said it is appropriate. So what I'm asking for you all is if you feel like that the MST program is appropriate for Waxahachie ISD students. I'm asking for a vote. If we do approve the vote, it would then go to our school board that the SHAC is recommending us to enter into an agreement. It allows us to have them on our campuses. It allows them to work with our teachers, with our counselors. They can come into the schools and work with our counselors. They don't do, the majority of their work is done in the home, but if the school is a trigger, if the school is somewhere that they need to go in and the therapist needs to work with the school counselor and the student, it would allow them to be able to do that. Right now we can't because we don't have an agreement with them. So that's my ask, yes.
So can I have a motion to move forward with the North Texas Behavioral Health Authority?
I move, hello?
Okay.
I move that we vote yes to enter into agreement with the North Texas Behavioral Health Authority for the multi-system therapy.
Yes. Okay. Well, we've got two, so.
Second, third, fourth.
Yeah. Yeah, Reverend Baker, yeah. Bobby. Okay. Well, I guess the question now is there any opposed? Okay, all in favor say aye. Aye. Okay. All right, thank you very much. All right. There is nothing else on the agenda, so I ask for a motion to adjourn the meeting at 12:34 today. Do we get a motion? Okay, Bobby makes the motion. and Melissa seconds it. So all in favor say aye. Thank you. Thank y'all very much, and we will see y'all next time.